I'd like to welcome our next speaker now, who is Dr. Arvind Nagra. She's a paediatric nephrologist at Southampton Children's Hospital. Welcome, Arvind.
Thank you very much. I was going to do some Madonna because I have one of these today, but I'm not allowed to move according to the guys at the back. So I do apologise. So I'm going to say thank you very much for asking me to come and speak, and really passionate, like you guys, about improving patient outcome and experience. And the stories that I heard this morning, only managed after coffee, Pamela and Sam, were really, really inspiring and sad in some ways as well. But so I'm going to be talking about patient empowerment and shared decision making. And what I've not played with this. But before we start, this is a really easy QR code. If people could just tell me in the audience who they are, whether you're an adult with a kidney condition, whether you're a family member, you need to get your phones out, guys. Sorry, my 25 minutes don't start till we've answered this. If people in the front have got a smartphone, it's really, really simple, just so I know who's in the audience, so then I can actually tailor my talk accordingly as well, which would be really helpful. And it's very simple. We like sliders, and there'll be another one right at the end. I'm only doing 2, so this is one of them, so we'll just see where we are. And guys, I know there's more than 14 of you in the audience, so it'd be fabulous, you know. Modern technology. I want to know if you're mainly... okay, so look at this. Mainly adults with a kidney condition. Super. Just so I know. Okay, I am going to put a timer on because I'm only allowed 25 minutes and I don't want to overrun. Okay, so thank you very much. So, thank you very much for responding to that, and I will make sure that my talk is targeted accordingly. Thank you. So, I'm talking about patient empowerment and shared decision-making, being really big on the NHS agenda for many decades now, and recently there's these guidance that came out from NICE, from shared decision-making, personalised care for the adult people, and there's a transition consensus statements. And the Ready, Steady, Go programs and the stuff that I'll be talking about today will be covering many of them. And it's really, really prescient at the moment, especially with the Lord Darcy report that came out in September. And his key messages are, you need to empower patients, use technology, and do something about the waiting times. The latter I can't do anything about, but hopefully working together we can do something with the other bits about empowering patients. And we know that empowering patients is really, really important. There's an Institute of Public Policy Research that actually was the basis for the personalised care plan for the last 5 years for adult services, because what that showed is if you empower patients, it improves their long-term outcomes. It also improves patient experience and it reduces costs to the NHS. So that's really, really important. And how can we do this? Well, this is where we developed a program called Ready, Steady, Go. Oh, I don't know if there's a light on here. So we originally started, I'm sorry, I'm going to stand in front of my slide. And I was told not to. We started off with transition about young people moving to adult services. And then we developed the blue one, which is the Hello to Adult Services, for use from 16 all the way to old age. Because we had patients with learning disabilities that were moving into adult services. And the comment for adult services was, wow, your patient with learning disabilities knows more than our patients that haven't got learning disabilities at 50. So we said, well, that's a really poor reflection on you guys. They've got the same issues that need addressing, anybody with a long-term condition has. So why don't we adapt the program for use in adult services? And it's a program that is used across all long-term conditions. And we used patient voices in different subspecialties up and down the country, and Nottingham were very heavily involved with this, and also patient organisations as well. We've also got the Hello to Children Services programme, which is a sister programme, and again, the questionnaires are the same, but a parent who's got a child diagnosed with a long-term condition is overwhelming, regardless of how mild or severe it is. And just to talk a little bit about the programme, it's been picked up across the UK and internationally, and it's also been used as an example of best practice. For the adult units that are using an empowerment programme, 96% of them are using the Hello programme. So, but what we always say is, I always bang on about this, please don't forget about the kids, you know. What do young people, adults and parents think about the move to adult services? And this was one of the reasons that we created the programme. It's what young people felt when they were moving to adult services. They weren't ready, they didn't feel confident about managing their condition. They also said they weren't given a choice about when they moved and who they were going to see, and they felt like they were being dropped off a cliff. And the adults said, guys, you aren't managing them, they don't know anything about their condition. We in paediatrics are mollycoddling them. And there were conditions that they were moving into adult services that they were worried about looking after. So this is what we're going to try and make blue, because they're new horizons, to see if we can do that through the course of the talk. And I'm part of the specialist interest group for the UK Kidney Association. I'm hoping that you guys will also want to be involved, because anything we do in that group goes up towards the elderly and also down towards conception. And the key bits that I'm going to be talking about is transition, which is patient empowerment, shared decision making, and also peer support and psychology, meeting psychosocial needs. So transition's been around a long, long time, and I'm sorry, Sam, that you did not get a good experience for this, because your story was heartbreaking this morning. It's been around for a long, long time, and every 4 to 6 years, you get a new recommendation about what transition is and what you should do. But to me, it's about empowering patients. It's about equipping them with the knowledge and skills to manage their condition, both in children's and adult services. Now, surely, when you're an adult and you get diagnosed, that's exactly what you want as well, meaning that we can use the same program in children's and adult services. And it's important because this is a Department of Health from 2006 document, and what that showed was the diabetes group, and I think Sam would fall into this, was that when less than 57% of young people, when they move to adult services, attend the adult service, which is really worrying when 94% of them do attend in children's services, and that's within 2 years. They disengage, and with that you get worsening of disease control and more hospital-related admissions. And the congenital heart diseases group, they're getting complex people that are surviving into adult services, but they're finding that mortality rates are higher than they should be because the patient's not being empowered, and they thought 20% were avoidable, which is really, really worrying. It's not unique to them. With the kidneys, what we found was that 1 in 4 patients lost their kidney transplant within 2 years of transfer to an adult service. That was in Canada. In the UK, Nottingham, just down the road, it was 1 in 3 were lost within 3 years of transfer to an adult service, and 90% of those should not have been. But with a transition program, which is patient empowerment, that fell down to 0. So this is a Canadian model, and our program is based on the Canadian model, which is the Vancouver one. So really, really powerful data. The Birmingham lot, what they showed in 2020, this is Tanya's group, that actually the most vulnerable group at the moment are the 14 to 23-year-olds. They've got a higher rate of non-attendance, and with that they get more transplant-related admissions, very similar to the diabetes data, so that is not surprising at all. But to actually increase the likelihood of going back to a kidney transplant, from a kidney transplant to dialysis within 10 years is really, really worrying. And it doesn't matter what age they were transplanted. This is a very vulnerable group. And they're vulnerable because if you look at the picture at the top, is the prefrontal cortex, in case you guys have teenagers and things at home, is not fully mature. So the risk-taking behavior and decision-making behavior and impulsive behavior is poor. So it's always important to remember that. And that does not fully mature till they're about 25. So we need to make sure that these young people are supported during this really crucial time. But we as paediatricians also have to do something. We need to make sure that we start at a very young age to put them into a positive spiral of behavior, because to break a bad habit at the age of 14 is incredibly hard. And I've got 7-year-olds that can tell me what their transplant medication is and why they see me. They're like sponges. Everybody wants to learn. And if you give positive reinforcement, it makes a big difference. Not only that, what we also know with this age group is they've got double the mental health issues compared to their well peers, and more are unemployed. And this does not matter whether you're a kidney patient or you're a heart patient, you're rheumatology, it is across the board for all long-term conditions. And many of these issues stem from childhood, so we're not sorting it out. And I'm sure the adults that presented in adult services will also feel that these issues are relevant to them as well. I don't think it's age-specific in that respect. And we've got a program called the Ready, Steady, Go Peer Program, which if we've got time, I'll speak about at the end. So, coming back to transition and patient empowerment, this is the Ready, Steady, Go program. Okay, it's a holistic program that empowers patients and carers. So if you've got an 8-year-old with dementia as a carer, you need to be looking after them so the carers can be empowered. And what it does through a series of questionnaires is make sure that we're addressing the issues that need addressing. And we co-produce this with patients as well. So there's questions that in the knowledge bit, I know about my condition, I know about my medicines, I know who to contact for help and when. There's also making sure that patients are involved in decisions about their care and shared decision making. We created this document in 2010, and shared decision making was at the key because we know that if patients are involved in decisions about their care, they are much more likely to adhere to it because it's about things that are important to them. And we suggest that they ask 3 questions. What are my choices? what are the pros and cons of each choice, and who can help me make a decision that's right for me, is how we as healthcare professionals structure our information, and also how we, you as the patient organisations, insist and also start thinking about structuring information that way. We also talk about sex, drugs and rock and roll. I usually throw in a bit of masturbation here, but I'm not going to, because I usually say that to my husband. But what I will say is that actually, just to show, I'm never doing that with my husband, he'll say that, but there is a question on there, just to show you can use the same program across subspecialties. It goes, I understand the impact of my condition and medication on pregnancy and parenting. That, to me, allows me to talk about the inheritance pattern of diseases. It also allows me to talk to the young girls about if you're on enalapril or MMF, it needs to be stopped, otherwise it will harm the development of the baby. It allows patients to ask questions that you wouldn't think that they would ask, or you haven't thought about, like the girl with epilepsy. She's 14, but we'll say she's 17. She goes, well, if I'm giving my boyfriend a blowjob and I feel a fit coming on, she goes, what do I do? You think, maybe take him out of your mouth and have a safe set or something like that. But she's asked it. And then the other question that one of the transplant surgeons said she'd asked, and if you've got transplants in here, how many of you have thought, if I'm lying down with my kidney transplant, can my overweight husband or wife lie on top of me? Have you guys ever thought of that? It is a question that does get asked, so we're creating resources about that. And it allows patients to ask questions that you wouldn't think about. Okay? So it's really, really important. We also talk about the psychosocial issues. Why me? It's not fair. There's a question that says, I'm happy with life. We've had young people tick, yeah. Comes to that, actually, I've got a shit life. I've got scars all over my body. I'm never going to get a girlfriend. I'm never going to leave home. And it's important to address those psychosocial issues, because if you don't, then these young people and adults will fail in adult services, because what we want to do is make sure that the quality of life is good for everybody. It's not just about the condition. And then transition is just about learning about your condition and self-managing. We've got an easy read version now, because the health literacy age in the UK is 9 for adults. The reading age is 9, and I'll show you some data later as well. So what we've done is we've worked with the Foundation of People with Learning Disabilities. We've looked at the questions. All the questions are relevant. We've made them more conversational, and now we've got some digital tools, and I'll show you what they look like at the end. I can't show you them, but I can show you some snapshots of it. And what they do is, if you're interested, you've got the Ready, Steady, Go questionnaires. We've got links. We've got digital links that link to your hospital. You use your hospital number, you fill in the questionnaire, and it can also read out the questionnaires as well. And then they get submitted back to your healthcare team. And I'll show you what that looks like after a while, okay? And that's really important. And that's something new that's come on board. I'm going to let you listen to what a young person says. Oh, no. So, Dan, I forgot to say this one. Are you able to play the top video? So what she's talking about is relevant to all ages, not just her. We would just do it at a different age for adults. Can you play the top one? I'm doing all right.
I'm Maria. I was first diagnosed with kidney failure when I was 10. I was really scared and worried at that point, but later on, thanks to Ready Steady Go program, I later found out that it's called HUS, and I was able to understand what my condition is and what the symptoms are, and I can look for that in the future, and it's all thanks to Ready Steady Go program. I was introduced to Ready Steady Go program by having a leaflet, an information leaflet, and then my next appointment I had the Getting Ready questionnaire, which is the red one, and then years later I had the amber, which was the Getting Steady, and then a couple of years later I had the green questionnaire, which was the Go, and we covered all the questions, making sure that I actually knew them instead of just blagging my way through.
And those questions, it also talks about employment as well, and education and what you tell your employers, and we're creating resources for that for all patients with long-term conditions. The mother at the bottom was really anxious about her young person going to adult services, but delighted that there was a program called Hello for use in adult services. And if you watch the video, it's really, really powerful. It's a game changer, because the patient voice is what changes hearts and minds of other patients, but also of healthcare professionals as well. It looks like a lot of questions. But when you look at the questions, a lot of it gets covered in clinic anyway, and it's relevant, and we need to make sure that those resources are there to support patients, to make sure it is holistic care that we're offering. This is an adult, I haven't got time to listen to her. She just says she loves the programme and thinks it should be introduced in adult services for all ages up until the age of 80. And there used to be somebody called Mark Jones here who's actually heard this and said when he was diagnosed in his 40s, he wished that this programme had been around for him for use in adult services as well. So does it make a difference? Or remember that diabetes data? This is some information that these people have shared, the diabetes group shared. Very similar. This is a decade after that original document that I showed you. Similar data. But by doing just the GO questionnaire, because that's all they could do, what they found was that actually they reduced hospital admissions and more were attending outpatients, but they couldn't get the diabetes control under in hand because we didn't start it early enough. When they started it early enough, all those results were even better and the diabetes control came into play. A young person that's been on the programme, this is really good, said, learnt about my condition, helped me gain more confidence and made me very relaxed with the adult team as well, and he thinks everybody should be on it. So I think we've addressed those things in blue, blue for New Horizons. But what about the rest of it, where they don't feel like they're involved in choices, they don't trust the adult team, and the adults are also anxious about looking after these conditions. So we then did some work with NHS England and a shared decision-making project called the Moving On Up Together 16 Plus Pathway. This is how they work through the programme. So at the age of 16, just so that you're aware, it gives you an idea, and it forms a model for all shared decision-making stuff, is that actually we talk to the young people and say, you know, you're going to be leaving us in 2 years' time. We need to make a decision about where your care will be. It's see nobody, see a GP or an adult in this centre or that centre. And depending on their care, sometimes you say, because of your degree of kidney condition or CKD, it doesn't warrant an adult, or it does warrant an adult. If it does warrant an adult, it'd be really good for you to get to meet them so we could do some joint appointments. They get to know you, you get to know them, and we try and stick with the same adult team. And we also make sure that there are emergency plans in place if they crash land anywhere else. Really, really important. But what we then do is we've then got this digital document here that actually documents where they're going to be, and this says how many appointments they're going to have, and then there's some processes here so that we can actually audit what we're doing, okay? And then we also want to make sure that actually we're getting feedback. Do patients feel involved in the decisions that they're being, or the decisions that are being made? So this, the SDMQ9, is a document that's by the German group, and it's a validated tool that's used internationally. We had permission to adapt this so it's easy to read, so it's for a reading age of 9 to 11. So this can be used in paediatrics and adults, and it's one of the approved and recommended outcome measures that's been used by NHS England. And you get your own code, and what I'm really interested in is the last one. The SDMQ9, I'm involved in decisions, we've made a plan, because often plans aren't made and patients don't know about it. And was the information useful? Because if it's not useful, there's no point in having it. And then there's a free text bit at the end. And this is what it looks like, so it's really easy to pull that data. And then when we looked at this, so remember we talked about young people not feeling engaged. Over half of young people don't know what the plan is. They don't feel they were involved in decisions. And that's not just young people, it's adults as well. And with that, they feel powerless. They don't trust the adult team. They don't attend clinic. They don't adhere to treatment. But just by doing that, we had 100 responses. 96% now felt involved in decisions about their care, and 92% knew what the plan was, and 90% found the information useful. Really, really simple, but comms is really important. So I think we've addressed everything there, which I think is important. And we're now going to be using this, we're going to be using it across children's units across the UK. The adults want to use the Hello to Adult ones, and it's also being used internationally as well. So then talking about shared decision-making, remember I said the average reading age is 9. 43% of adults do not understand the health literacy, the health information that they're given. If you add in percentages, it's even less. Meaning that actually we can work together with adults and paediatrics to develop resources and use different infographics. And I'm going to give you an example. And what we also need to remember is that actually we're visual learners, and about if you reinforce the senses, it's much more reinforcing the effect of any information that's given. So we should be using videos as well, and we need to include patient voices and make sure they're co-produced. So I'm going to let you listen to Jess.
Hi, my name's Jess and I have a son called Jackson and he's 19 months old. He was born with ARPKD and was completely anuric, so he started PD straight away. We found out about Jackson's kidney problems quite late on in pregnancy, and it was picked up randomly when I was around 27 weeks. Like most people, we went on Google and we tried to find more information about ARPKD and dialysis for young babies. We struggled to find anything positive, and most of the information was catered towards adults and older people. This obviously worried us even more, as we didn't know what our lives would be like with dialysis and a young baby. Once Jackson arrived, he went straight to NICU. He was there for a month and then transferred to the nephrology ward. We had a difficult few months in hospital. Not only was I a new mum, I was also trying to care and learn about my medically dependent baby during the early days of COVID. We found this time very challenging and overwhelming at first, but we soon got the hang of it, the dialysis machine and feeding tubes with the help of the nurses. Once Jackson came home, he really thrived. He's still a little delayed with a few things, but he's catching up very quickly. He's a lovely, happy little boy, and if he didn't have an NG tube, you wouldn't know that he's on dialysis. A few months ago, I was given the opportunity to be part of Dialysis Choices and Shared Decision-Making Group. I think it's really important to get parents involved, as we often see things differently to medical professionals. This is our life and we deal with this 24/7. I found the whole experience really positive and rewarding. I've made a few videos and I've shared my opinion on different topics. The group has come up with some really useful information and content, which I think will make a difference to parents and children who are new to the dialysis world. It will offer the best information to them and hopefully make the process easier and less stressful.
Really, really powerful. It made a huge difference. And when doctors have heard this, they go, oh, actually, yes, what's important to us isn't always important to the patient. So that's why resources need to be co-produced. Jackson is now 3 years old. He has a lovely, lovely little ponytail and a lovely transplant that is working very well. So this is just the dialysis choices thing that we did. We use the Ask 3 questions, and I would suggest that if you can, get this into all patient contact areas. It allows patients to have a voice, and it gets healthcare professionals thinking that actually we should be structuring our information around this. We created an A4 piece of paper with a chart, and this was an MDT, adults and peds across the UK with patient voices and the charities involved as well. And we created this resource, and what we've done is we've then put in patient voices. Dan, are you able to play the videos, please? I've still got 5 minutes, guys, we're doing all right. So what you do is...
What's it like being on hemo?
You put in the frequently asked questions that people have.
Is it nice? Does it hurt when you get hemodialysis?
Always a real worry for patients, regardless of age.
Does it stop you doing things? What are you doing at the moment?
Playing Roblox.
Oh, wow. Do you sometimes have to do schoolwork when it's school days?
Yeah.
Yeah? Yeah? When you first started, were you worried that it was going to hurt?
Yes.
And I always say it doesn't hurt.
And then who made it feel better?
The hemo nurses.
Yeah, the hemo nurses. Oh, well done, Kevin. That's super. So is there anything that you would say to another child that's going to be thinking about hemodialysis?
It feels fine.
Lovely. Can you give me would you give it a thumbs up then? Do you want to give me a thumbs up? Yay. And then do you know what? Are you happy to just show them what your hemo line looks like? Look at that. Oh, wow. That's amazing.
And that's what, if you just think about that just reassures parents, even when they know their child's not going to need it for 2-3 years. They see that and it just makes them feel so reassured. And the parents, will you show the other one as well? And parents are also happy to do videos because they always think my child's going to look sickly. So this is one that a parent did, and we've got consent forms to show this. And we're developing the resources. And you place in videos that you think will make a difference and put in frequently asked questions as well. So he's looked healthy and again, very, very reassuring. In the interest of time, can we go back to the park? I would love to show him because I love it when patients give us videos. Okay, next slide. So what we've done is populate it, and now what the adults are doing, they're using the same infographics they're using the same text, and there's an organisation for the specialist interest group at UK Kidney Association. We're populating it for the different age groups for older populations as well. So what we also want to do is actually, do you remember that form we had the 16 plus before? We want to make sure that the patients feel involved in that decision. The conservative treatment is also there. All the resources we've shown, the dialysis grid, speaking to other patients, InfoKid, radar if needed, and all the processes and referral patterns are there as well. And then with that, you have your own survey for that particular pathway, and then you can benchmark across the UK. And what it looks like here is, these are the Ready, Steady, Go forms. It gives you the number of forms that you've got. It gives you a breakdown. So if it's the dialysis choices, it would give you that. And as a UK group, we could actually see you can benchmark against regions and against each other, and certainly the integrated care boards and hospitals are interested in this, and the bar charts show where you need to actually provide more support. So it allows for benchmarking, standardization of care, and improving care is really, really important, so there's no postcode lottery. We're doing some other resources like transplant choices and AV fistula. They will be coming with time within that group. This is Evan. I would let you hear him talk. He just says, guys, please get involved with shared decision making and use your voices. It's had a huge impact on him, and he gives it a big thumbs up. And that's the poster, as I said, for all age groups. No, you're not. So now what about the psychosocial issues? I'm sure when you see this video, when you see this slide, it relates to a lot of you as well, not just the young people. So we've got art therapy for this. So this is where we've got a peer support group. It's a virtual support group. It was all charity funded, and the KPAs were really, really supportive of this. This was in Southampton. And with it, they do fun activities. They get awards to improve their self-esteem, but also their CV, and they use their voices for service improvement, amongst other things. And we link in with outside charity groups as well to make a difference. In adults, it's called social prescribing. So then there is money out there through your GPs that do events. So this is where they've learnt new skills. We had somebody over here coming from the university to teach them how to blog and vlog so that they can then help other patients. And at the bottom, a patient support group and a parent support group actually came out of it as well. So it was wonderful. Here, there's a free day, the conservation groups. You can organise those and go out and actually save the planet. The families can get involved. And it's, wow, look at what we did, and it improves self-esteem. There, on the left-hand side, there's organisations by the council, and there's some food-wise courses. Dietitians always important. And they've also done the Duke of Edinburgh Award. And if you go onto the peer website, you can hear what the young people say, because often they feel they can't do it, and are absolutely delighted when they say they can. And when COVID came, we had to go virtual, which was meant that we could actually meet the needs of more patients, and there was no postcode lottery, and they still had fun on it. And suddenly the number of patients they saw was much, much bigger month on month, and certainly there's even bigger than that now. And what we found was pre-COVID and post-COVID, they actually felt like they were part of a friendship group. They felt more confident, they felt they'd learned a new skill, and they felt more independent, and they felt better about themselves. And when the parents were asked to score how these young people did, patients are always hard on themselves. They'd actually said they scored them higher, so it was really good, suggesting that a psychosocial group does work, and it can be virtual as well. And this was World Kidney Day a few years ago. We did it across the 3 nations, and it was very successful. So next thing, the last couple of slides coming up now, it's the National Virtual Youth Group is now just being set up. We're launching it on the 18th of December, and it's going to be across the UK, and it's supported by the charities, so the NKF, the UK Care Association as well, and also the Ready, Steady, Go Hello charity. And I think watch this space, and we'll show people how to sign up for it. And hopefully I've shown you Ready, Steady, Go and Hello. It's holistic. It empowers patients, which is really important. This was made with no money whatsoever, just a bunch of enthusiastic people. Everybody understands the traffic light system. You can just pick it off the shelf and start using it. Parents have said, my doctor wouldn't start, so I've just started doing it myself. And it works across all subspecialties. And I think you'll get seamless care from paediatrics to adults. There's a big collaborative nationally and internationally. And what we're also doing, we are creating resources, because this is important. So with the UKKA is we're doing, we don't want postcode variation in care, because that's not fair. So some patients get extra time for exams and college work, but actually that's not across the UK, and it should be for CKD 4 and 5, definitely. Tacrolimus, enalapril, they can actually affect processing. So why are we disadvantaging ourselves and our patients? We also want to talk about sex and contraception. So we've got experts in that, including patients as well. So that's where we've got the, big chap lying on you, on your transplant. But does it affect the transplant? But you need to be pragmatic about it as well. We're also creating videos for Hello and Meet the Team. And let's do checklists so things don't get forgotten. So when you're CKD4, you should be having this this done, your blood pressure should be this. You need to make sure that you're entitled to these benefits, and these are the things that you can actually be entitled to. So the MDT and also the patients know what they're entitled to, and make sure that you hold us to account as well, because that is important, because we sometimes forget. And then it's an opportunity to share resources, improve outcomes, and it allows benchmarking, and it's sustainable as well. So now, guys, this is one QR code. I've already answered it. I think all of the above. So looking at these, do you think, as patients, which would you support us as an association, us as a group, as KPAs moving forward? Do you think, so all of the above is obviously all of these. So all of these below is what I mean, okay? So would you support the use of Ready, Steady, Go for everyone? Would you support standardisation and association-approved letters? So then that actually makes it much, much easier. Getting sex resources, really, really important. My husband keeps telling me, sex is really important. We are going to ruin our relationship. Do I care? No, I don't. I'm not spreading for anybody. Anyway, but joking aside, it really is important, and relationships break down, and you need to make sure it's all right that you talk about these things. And let's talk resources. But if you do think that actually we should do all of them, and as an organisation we should think about that, then I think your voices can make a difference, and I can take it to the association and say, this is what the patients want, so what should we do about it? Yep. And standardisation support. But if you think all of the above, that is flipping marvellous. 20 guys, any more, or are you just too slow for that? No? I don't know. Well, why don't you show me hands? Who thinks all of it would be helpful? All of it. Okay, so will you support me if I say the whole group said all of it? Yep, marvellous. Okay, it's fine. Who thinks none of it? No. Okay, that's good. All right. So all the resources are there, and you can go onto the website, and those are all the programs that we do. And as I said, it's been done with no money whatsoever. Enthusiastic people. We've now had to create a charity, because there's only a few people that are actually trying to spread it. But by creating a charity and an organisation, we're spreading the word, and this way everything. There's no chief execs, it's only trustees, so all the money goes back in for patient empowerment, improvement, and improving patient experience. And the TIER Collaborative is the national and international collaborative that is the working group of it. What we don't do is we're not in competition with charities. We ask charities to support us, so we don't go to the patients, and we go for grant funding like the big lottery. So those are the sorts of things we do. So there's no competition. And underneath this, Cardiac also want to work with us under the collaborative, because I think charities working together can be quite challenging sometimes, because you're going for the same patient group. And then we're also working with the associations as well. So hopefully you guys will want to be involved, and if you do want to be part of the association or that specialist interest group, even if it's only for 30 seconds or a couple of times a year, please do get in contact, because I think it will make a big difference. Thank you. Thank you for listening.
Thank you very much, Arvind. If you'd like to take a seat. We've got time only for a couple of questions. Is there any questions in the audience, please? When you actually ask the question, can you stand up, please?
Hello, Christine Price from the Six Counties Kidney Patients. Thank you for that great talk. We all know that most people with chronic illnesses all are empowered and very serious about their illness. My comment is really only a comment rather than a question. What I have noticed from personal experience is empowerment sometimes can be a problem when it comes to short-stay acute environments, particularly daycare, where there's set protocols and the staff won't listen to the patient who's empowered, because the protocol says we have to do this even if it's detrimental to your care, and I've witnessed that on numerous occasions.
So if that's something that you write to the group about or email me about, that's something I can take back and actually raise. And if you think of things that are frustrating, or you think actually that's not right, or you think would make a difference, do let us know, because we can't change things without knowing. As an organisation.
Much more in the acute environment.
Oh no, I understand that. But even in the acute environment, there is still supposed to be shared decision-making and patient empowerment, and the patient voice is supposed to be heard. So we are trying to do that.
And I think it may go back to training.
Yeah.
That quite often nurses and medical students still aren't being trained about the importance of communication and how empowerment actually helps people with chronic illness.
Yeah. And That is big on the NHS agenda, and we are creating videos and an induction now. Certainly I've been involved with that, about training new healthcare professionals and nurses about the importance of shared decision making in the acute and chronic setting. Yeah.
Hi, Dr. Arvind. Thank you. That was really good. As you know, I run KDARS for Kids, the support group for children with renal issues. My question to you is, how can we, I know obviously how we can get involved, but as a group, as a support group, I feel that today it would have been really beneficial to the families that we support. Is that video going to be able to be put onto KDARS so we can share that and maybe get more families involved?
Yes?
Yeah, excellent.
I like these single questions. That's something my husband wants to hear every night, but he doesn't. A little bit of poor humour, very guttural, I apologise. And just to say, with the diabetes group, it's not that they used the Ready, Steady, Go programme. What they did was they built an education package using the Ready, Steady, Go questions, so everybody stayed on message. So what we're trying to do with that programme is, where it says, I need to know about shared decision making, there is a link that will take you. What do I need to say to my employer? There will be a link from an employment lawyer that says, this is what you need to say. Patients don't go for certain jobs, and young people don't, because they say, well, why would they employ me over somebody who's sick? But you think over somebody who's healthy, not realising you don't have to declare it because they think they have to declare it. But that is discrimination. But yes.
Well, just one more then, just Erica, and then we'll have to break.
Me and Zach, he's actually going through the Ready, Steady, Go right now. But one of the main things that I think needs to be improved is there needs to be more help for people with neurodiverse issues like ADHD, autism, PDA. Because even though, yes, it's fantastic, and yes, you do learn things, it doesn't go into, well, what if they can't remember the medication? What if they have attention issues and they forget things? How are us as parents supposed to get around that?
And that should be in there, because we did work with the Autism Society as well, and the neurodiverse, and that's where your youth workers and peer support people should be coming in, because you can't always remember it. So then we say take pictures, or there's you always have a picture of your last clinic letter so you know what your latest ones are. You don't have to remember it. You just need to have some strategies in place that you can just show them the phone, or do this or do that, and just make sure that that's always there. I know it's not easy, so I am sorry, but happy to chat about that after, and let's see what we can do, because we can make a difference. I believe we can make a difference nationally and internationally, but working with patients and using their voices.
Wonderful. Thank you very much to Pelly and to Arvind for this session. We are going to break for coffee, and everybody needs to be in here back for 5:02. But Alison, that spoke this morning, that's the renal social worker, would like to present her case study that she didn't get a chance to do. So if people want to stay in here and listen to that, please do. If you want to grab a coffee and come back, please do. But thank you very much, both of you. And Alison's going to come on the stage now. Thank you.
I think what I'll do is I'm going to make a start, because I think we've got given enough chance for people to make a move, and those that want to listen, I think I need to get on with it, so you two can have a break and go and get a coffee. So I wanted to discuss the case study because it might resonate with some of you, and some of the issues that people face in a crisis situation. So we're going to go through the case study, hopefully very quickly, but it might give you some information and some guidance about what you can access out there. So we've got Mr. Simon Credit. He receives in-centre haemodialysis, and he has additional health issues. His phone since starting dialysis, this has impacted further on his conditions, and his health has resulted in a difficult decision to stop working, and as a consequence, he now feels a sense of loss, and it's impacted on his mood. He's breathless, his mobility remains poor, and he's fallen a number of times in recent weeks. He's slipping into debt because of his inability to maintain employment. His wife is his main carer, and the role has since increased, and her role, has since increased with his decline in health. For example, she supports more with his personal care. The washing machine's just broken. It's just a real crisis story here. And they can't afford a new one, and she's now hand washing the clothes. They live in a private rental first floor accommodation, and due to their inability to pay the rent, they've been threatened with eviction and homelessness. So if we just move quickly, I just want to go through some of the areas. So what we do when case like this lands on our desk, and it does really frequently, we try and look at the most important areas. So here, in Simon's case, it would be that he's facing homelessness. Now, what I would have said to Simon, if he'd have come to us earlier, I probably won't say this to Simon, but what I'm trying to say, if people come to us earlier, then we can negotiate and try and support on their behalf to prevent it getting to a crisis situation. So perhaps we will contact the landlord and see if we can do a payment plan. If we can't, then we'll contact the homelessness departments in local authority. We might help Simon apply for suitable housing, and with that, supporting letters, and ask Simon if he would like to contact Shelter. Shelter are a really good organisation, and that they're really knowledgeable on housing issues. Now, with his income, Simon has stopped employment, so therefore we'll look at the benefits for Simon, and we'll discuss perhaps PIP, universal credit, carer's allowance for his wife, and ESA. And we'll probably ask him to go to supportive networks. If there's not a renal social worker, perhaps we'll look at CAB. But what we will say to Simon is that get a copy of your application, because if you've got a copy of your application, when you go to assessment, you can take that with you, and they'll ask for more information about how things affect you, how your mobility affects you, and you can look at what you've written and you can add on to that if you like. But if you don't have it with you, you might become flustered. So we will say, get a copy or take a photo on your phone, just have it with you and seek guidance. And if you want, get somebody to go along with you and support you, because having that person with you just as a reassurance is a big thing. It's scary, and I know that it can cause anxiety. So if you can get support networks, then please do. So he's in debt. We might say to him, contact Deadline, contact the National Deadline Service or Step Change, because they can help with negotiations and budgeting. I've noticed in the past with, I have problems doing negotiations with council tax. I find them horrendous, the council tax departments. But I find Shelter get more of an impact, get more, get things moving really, and they're very knowledgeable on that area. If you need a care package, contact social services. Ring up, if you don't know the number, ring up your local authority. So I'd like to speak to adult services, social services, or children's services, and they'll put you through to the duty social worker. And the same goes for occupational therapists. Contact your local authority and they will help with those applications. If possible, Simon's had a few falls, so it also, in some areas, they have falls prevention teams, and you can contact those through local authorities as well. So if you don't know, what I'm trying to say is contact your local authority. Say, this is my issue, this is my problem, and where can I get support and help? And they should be able to point you in the right direction. If they can't, ask to speak to his member from social services and see if they can support. They should be a wealth of knowledge. They should be able to help you. So there's also telecare, care lines, and also sensory movements, sensory detectors, and they're also linked to the local authorities. So if you don't actually know who to go to, phone up, tell them your problem, and hopefully they'll point you in the right area. For his low mood, some units have renal social workers, some don't. And you can go to a GP for a counsellor. They might not understand the renal though, But you're the person that knows about renal, so you can give them information about how it's affecting you and the ways it's affecting you. And also there's charities that offer counselling services and helplines, so contact those. Activities. So they should be now that support networks within the community. So you can go on Facebook, you can contact local authorities, and they should be able to give you organisations that can help with social activities to get you out and about. And finally, with the white goods, there are charities that offer grants. And I did speak to you before about Turn to Us, where it can be linked to a profession and you can get a grant from there, or there's a Kidney Care UK. And in different areas, we've got some support networks and charities that's actually associated with Wales that can offer grants as well. If you require food bank, then we can make that referral for you, or you can go to Trussell Trust and they will help you with that. And there's also wellbeing vouchers. So what I'm trying to say is there are organisations out there, there is some support if you don't have a social worker. And it's just making those connections. So I'd like to thank you for staying and listening to me, and hope that's given you some more information from today. Thank you.